take you back to Kempinski, where the Cabinet Secretary for Health, CS Kariuki, is currently making an address. Let's listen in.
Causes of death and disease, the incidence and mortality from non-communicable diseases and their determinants are rising sharply, resulting in a double burden of disease, further straining our health system. What does this effectively mean to us in this room? It means that we need to relook at our healthcare architecture. We need to be disruptive, and it's a word I like using because I believe in it. Disruptive enough to explore and implement innovative business models and health delivery mechanisms that will enable us to offer cost-effective healthcare with the available resources. As I walked in, the President of Verian spoke to my heart by confirming that the deal you are getting into today is going to help us in matters affordability. It's going to help us in matters access. It's also going to help us in matters sustainability, and hopefully we will be able to cover more Kenyans that we would have otherwise covered had you not gotten into this understanding and new business model. What we're witnessing here today between Mediheal and Verian Medical Services is, to me, a great example of such an innovative business model, and will go a long way in complementing the efforts of the ministry towards addressing the double burden of disease and also on delivering the promise of UHT. Specifically, this partnership will advance Kenya's fight against cancer. This is a significant matter because cancer is the third leading cause of death in Kenya after infectious diseases and cardiovascular diseases, accounting for 7% of total national mortality every year. The growing cancer burden, if not addressed, has the potential to cause negative socioeconomic effects on our communities, as well as increase the cost of healthcare provision and therefore cost of delivering on UHC. The Ministry of Health does not only encourage innovative business models, such as the one we're witnessing here today, but also remains committed to providing the requisite stewardship in responding to the growing burden of cancer and other non-communicable diseases. As a testament to this stewardship, the ministry is currently implementing the National Cancer Control Strategy, starting last year and taking us all the way to the year 2022, which has prioritized screening and early detection, timely diagnosis, greater access to treatment, and monitoring and evaluation and research as critical pillars towards cancer prevention and control. I heard the PS emphasize this because oftentimes I'm worried my name could become primary health care, because all these are elements of primary health care, because that is where we need to start. That is where we need to remain. That is where we need to invest. The ministry is also working to explore affordable and sustainable mechanisms of scaling up access that goes towards the preventative but also curative services for cancer and other NCDs. Part of this work is currently ongoing, led by the Essential Benefits Package panel, made up of experts that I gazetted and appointed only 3 weeks ago. The Ministry of Health has, in its current financial year, as well procured radiotherapy machine to be utilized at our MoU Teaching and Referral Hospital, which is one of our level 6 national facilities, and will expand access to radiotherapy treatment centers across the country, but particularly the Rift, Nyanza, and Western regions. The Ministry of Health is also setting up 8 chemotherapy units across the country to further decentralize oncology care across the country. In this light, the proposed establishment of radiotherapy centers under this MoU is welcome, as it will contribute to the overall vision of universal access to cancer treatment in this country. I'm pleased to note that in addition to setting up the radiotherapy centers, this partnership will also lead to setting up of educational and research centers, which are critical pillars of improving cancer care in our country. The ministry will provide the necessary policy guidance to ensure that the centers are aligned to our strategic priorities in cancer prevention. In turn, the Ministry of Health will also leverage on the centers once established so that they can contribute to improved cancer care and evidence-based policy development. As I come to conclude, ladies and gentlemen, I'd like to reiterate the commitment of the government through the Ministry of Health to providing leadership in the noble and timely pursuit of UHC. I urge all of us to join hands with the ministry in delivering His Excellency's vision of UHC by the year 2022. And indeed, it is my belief, 5 months into my assignment, that it is possible we can actually get this target met. Finally, while speaking to my brother there, Honorable Mishra, I wish to extend an appeal for us to get support in treating the victims of the fire which hit Gikomba yesterday, that the Kenyatta National Hospital, where we are handling this matter, is sufficiently overstretched. And as a private sector actor in this sector, if you're able to lend a hand, we require some of the patients moving to some critical care and attention. So any support will be greatly appreciated. Beyond that,
Health Cabinet Secretary there, CS Kariuki, making an address during the signing of a memorandum of understanding to supply LINAC machines to help with the cancer treatment. Of course, this move is meant to reduce the number of Kenyans that are traveling to get cancer treatment. We want to take a short break here on KTN News Center, but we still have much